Healthcare workers at the forefront of the fight against coronavirus, sharing concerns about the amount of personal protective equipment, PPE, they have. Those worries come anonymously into our newsroom and from the head of the association representing nurses in Arizona. ABC 15's Mike Pelton with their message tonight.
Well, one Valley ER nurse tells me they're restricted in what equipment they're allowed to wear in the ER. She says they can only use an N95 mask if a patient is back in isolation. The problem with that, she tells me, is that somebody can walk into the ER with all the signs of coronavirus, and by the time they're back in isolation, she and other staff members have already been exposed. And similar concerns making their way to the head of the Arizona Nurses Association.
Nurses don't feel protected 100% of the time, especially in an emergency room when you're not sure who's coming through the door, and the masks are being selectively given out as the managers think appropriate.
Robin Schaefer is executive director of the Arizona Nurses Association, which recently sent out a survey about COVID-19. Roughly 1,300 out of nearly 100,000 Arizona nurses responded.
The general message was that nurses are most concerned about PPE, personal protective equipment.
The state has obtained and is working to obtain more equipment, but Robin says they are working to send a message to local, state, and federal officials about the need for more.
We have heard varying reports from nurses. Many of them are very scared. They are scared because they don't want to bring COVID home to their families.
Robin says nurses also want all of us to help them by social distancing and helping prevent healthcare workers from also getting sick.
I can honestly say that the healthcare community is just as scared as the population. However, we care for patients because we need to, and we are there for them every step of the way.
Robin says a second survey will go to nurses to hone in on issues around protective equipment. Mike Pelton, ABC 15, Arizona.
It's a case